Hi, this is Clyde Yancey, Professor and Chief of Cardiology at Northwestern Medicine. I'm with you today for a very special reason, to celebrate Bob Baunow. Bob, you've just been named one of the 5 recipients of the AHA Distinguished Scientist Award for 2024, an especially noteworthy award because it's during the centennial celebration where everything has a little bit more sparkle, but an important award. So congratulations.
Thank you, Clyde.
So what are your gut reactions?
Well, you summarize some of that. It's a honor when you're selected by your colleagues because they came to me and said they wanted to do this. And as you pointed out, it's kind of especially powerful for me this time because it's in Chicago and it is the 100th anniversary. So to be recognized, this year in particular is kind of special. Research is such a team sport. And anything I've accomplished is only because I've been surrounded, luckily, by very bright people.
When you think about where we were with aortic stenosis and where we are, give me like a minute reflection on that.
Well, so I've been unfortunately doing this for half a century, 50 years worth of research, where we initially had, no imaging tools at all other than chest x-rays and the angiograms. And then starting with some basic imaging tools in the 1970s, M-mode echo. And then if you wanted an ejection fraction, we got a radionuclide angiogram. So now it's all different how we do things. But having been part of just watching the evolution of the technology, as well as the ability to study the natural history of patients, and more recently to have these well-designed randomized clinical trials. We wrote guidelines in 1998. There wasn't a whole lot of evidence, and nothing changed for about 10 years. It was kind of a quirky science of listening for heart murmurs and teaching medical students, but it's just exploded in the last 12 to 14 years. And, now we have great randomized clinical trials, and the evidence keeps happening so rapidly that the guidelines can't keep up with it all.
Your journey is such a beacon for the early career professional who's thinking about cardiovascular science, cardiovascular medicine, cardiovascular health. What are 1 or 2 pieces of advice you'd give to that early career person?
You have to follow your passion. The first patient I saw as a medical student in my cardiology month was a patient with aortic stenosis.
Oh my.
I started reading the literature, realizing who are the people that maybe to work with. That drove me to work at the NIH. I surrounded myself with, again, really good team. We're always telling people to focus. But with your focus, don't focus too narrowly.
Don't miss the opportunity.
Watch your peripheral vision for other things that may be happening that could connect you with other bright people.
So for everyone viewing this video, join me in celebrating an incredible living legacy of Bob Baunow and his contribution to our understanding of valvular heart disease. And if you're just beginning your career, listen to this advice of what's necessary to move forward. Be focused, but also be facile. Be committed, but also be malleable. But whatever you do, make a difference. Congratulations, Bob.
Thank you, Clyde.